June is observed as Myasthenia Gravis Awareness Month all over the world. This is taken as an opportunity to raise awareness about the various facts and challenges about myasthenia amongst the patients of the myasthenia and their caregivers as how to cope with them. This is also taken as an opportunity to train healthcare professionals as how to diagnose myasthenia at the earliest, because myasthenia is often underdiagnosed and misdiagnosed because of the fact that its clinical features overlap with many other conditions, and this is a rare disease. So this month is taken as an opportunity to train healthcare professionals as how to diagnose myasthenia and start treatment without delay, just to avoid any misdiagnosis or delayed diagnosis. This also calls for attention of the government and the policymakers for creating an equitable and accessible healthcare to the patients suffering from myasthenia. This month is also taken as an opportunity for the myasthenic patients to mingle with the patients of the similar illness, to know about their stories and to share their stories, and to feel heard and cared. This Myasthenia Gravis Awareness Month, let's all, the whole world, come forward and do our bits, whatever possible, to make the life of the patient suffering from myasthenia better.
Myasthenia gravis affects over 70 lakh people globally, making it the most common disorder of neuromuscular transmission. Over 70 lakh people across the globe live with myasthenia gravis. Awareness is the first step to early diagnosis. One in every 5,000 people globally is affected by myasthenia gravis, and many still go undiagnosed. From Asia to the Americas, myasthenia gravis continues to challenge patients and physicians alike.
Symptoms of myasthenia gravis include muscle weakness, often affecting the eyes, face, throat, and limbs. Patient may face conditions like dropping eyelids, double vision, difficulties, slurred speech, etc.
The eye test is simple, non-invasive bedside procedure used to help diagnose myasthenia gravis, particularly in patients with ptosis. A positive result is indicated by a noticeable improvement in eyelid dropping after applying ice for 2 to 5 minutes. The test is quick, typically completed in under 10 minutes, and has high sensitivity for detecting ocular myasthenia gravis. It can also serve as a useful preliminary tool to guide further diagnostic testing, such as antibody assays or electromyography.
Neurosciences test is a bedside diagnostic test for myasthenia gravis, can be conducted on an office setting. Before starting, ECG, heart rate and blood pressure are recorded. Atropine 0.6 mg is administered to prevent side effects, followed by neostigmine at a dose of 0.5 to 1.5 mg for adults, with the dose adjusted for children based on weight. A clinical assessment is carried out every 15 minutes after neostigmine administration to evaluate improvement in symptoms such as ptosis for muscle weakness. A significant improvement indicates a positive test confirming myasthenia gravis, while no change suggests a negative result.
RNST detect abnormal neuromuscular transmission, a hallmark of myasthenia gravis. It shows a decremental response in muscle action potential with repeated stimulation. Help differentiate myasthenia gravis from others neuromuscular disorder. They may mimic similar symptoms. RNST is particularly useful in generalized myasthenia where ocular tests may be insufficient. It provides objective data to support clinical diagnosis. Non-invasive and safe RNST is a key component in the electrophysiological workup.
To manage myasthenia gravis, we focus on controlling symptoms and calming the overactive immune system. The first step is using medicines like pyridostigmine, which helps improve the communication between the nerves and the muscles, making movement easier. To reduce the immune attack, we use drugs like steroids or other medicines that slow down the immune system. In emergencies, when weakness becomes very severe, treatments like plasma exchange or IVIG or intravenous immunoglobulin are used to quickly remove or neutralize the harmful antibodies. Sometimes there's an issue with the thymus gland, such as tumor, then surgery can be done to remove it, called thymectomy, which might help improve the condition. Finally, regular blood tests, checkup, monitoring, and regular physiotherapy and learning how to manage daily life with this condition are essential. With the right treatment and care, many people with myasthenia gravis can live a good quality of life.